Hello and welcome to ActiveNet Bites. ActiveNet's expanding. We're going to be delivering a private sector event on the 13th of February at Stansted at the Radisson Blu. And I'm really pleased to say we're also changing the way we run our CPD and our education parts. So we're going to be doing some workshops, and somebody who's going to be delivering a workshop for us is Hussain Al Zubaidi, who's here with us today. So hello, Hussain. How are you today?
I'm very good. Thank you, David. How about yourself?
Yeah, I'm well, actually. I'm a bit frustrated because I was out last night and I haven't done any exercise today. I didn't get up early enough this morning. So I'm just looking outside and seeing the weather's looking all right. So I might get out on my bike or get down the allotment. But otherwise, I'm fine. Thank you.
Good. Good man.
Hussain, tell us who you are and what you do, please.
So yeah, my name's Hussain. I'm a GP based in the UK who studies lifestyle medicine. So this is an approach to medicine where we focus on the core pillars in our lifestyle to enhance our health, to improve our mood. And these are things like physical activity, nutrition, sleep, etc. And I got into lifestyle medicine about 8-9 years ago, initially from a personal journey. I struggled a lot with my own weight. I'd recently been diagnosed with what's called non-alcoholic fatty liver disease. This is where when you carry a bit of additional weight, it goes into your liver and it can start to impact your metabolic health. It's very much like a precursor to type 2 diabetes. And that journey on myself, improving my fitness, improving my nutrition, I wanted to translate to my patients. So as well as being a lifestyle GP, I hold the role at the Royal College of GPs as the lifestyle and physical activity lead. And I'm a medical advisor for Swim England, as well as supporting educational content through companies like Red Whale, GP Update. And I have a number of other portfolio roles where I consult with companies to improve their understanding of lifestyle medicine and nutrition.
Excellent. Well, I guess that personal trip is really quite important, is because I understand when you train to be a GP, you actually don't get a lot of formal training on physical activity and moving more. So your personal journey then seems to have really influenced what you're doing and why you're doing it.
Very much. In GP training, which is 3 years, this is obviously after you've done university, etc. You get 0 minutes on physical activity. Right. And in university, over the 6 years, you get 4 hours. So like it's a drop in the ocean. And those 4 hours, these aren't dedicated like a whole 4 hours to physical activity. This is just little bits just dropped in as side points, as you know, bit of seasoning on top of other information. And that level of education or lack of really explains why when we look at the confidence levels amongst healthcare professionals, when it comes to advising patients around physical activity or even just signposting them, they lack that confidence. About 80 to 90% don't feel confident even in signposting. Right. And nearly a similar percentage don't even know what the chief medical officer's physical activity guidelines are. And this is really, really troublesome because a lot of the issues that we face as a nation at the moment around the growing rates of long-term health conditions, we know that physical activity will have a profound impact in lowering that. And if I just say one last point, you know, a study from the WHO, the World Health Organization, found that 60 to 70% of all long-term conditions would be eradicated through active movement and a healthy diet. That's 60 to 70% of disease burden. That would make a massive difference, not just to people's lives, but to the NHS.
Yeah, absolutely. So, and that's the key to the messaging that we're going to be doing as part of the workshop. So what are the sort of things you're going to be talking to our delegates about within these workshops that will help them understand their communities better, understand the reticence potentially of GPs to refer moving and physical activity, and how we can break down a few of the barriers to really make a difference in the places that we all live and work?
If we're going to solve some of the big challenges that we face, simply put, the individual sectors alone cannot achieve it. On their own, they will just lack the key ingredient that's required for a patient to go from a point of being, let's say, diagnosed with a chronic condition or being sedentary to a position where they're active. Because firstly, we need behavior change, where we need to improve not just the healthcare professionals, but also fitness professionals' ability to understand the process of behavior change, because it isn't as simple as just getting up and doing it. And I know that For many, where they've already established good lifestyles, it can seem quite easy, and you just wonder, why don't people get active? But there's loads of barriers that stop people from achieving that. We have to be sympathetic to that and be intelligent. So I'm going to be talking a little bit about behavior change and how we can do this. You don't have to be an expert, but there are simple tricks that you can do to guide someone from that sedentary activity to movement regularly. And we need that close collaboration and connection, because we can't expect GPs, nurses to be experts in physical activity, and we don't need them to be. But what we need is to have a good, robust communication between the two sectors. And I'm going to discuss how I've done that in my area where I work in Leamington Spa, where we have a really good network, not just of, personal trainers that are self-employed, but also our local leisure center and the various different fitness groups. Because in reality, there isn't one movement that's going to fix everyone. Everyone needs to find their own particular way of getting active. So you need to know your community and know the expertise that's out there. And that's achieved through having good communication links. So one thing that I hear a lot from fitness professionals is they can't get into the room with the healthcare professional. They don't know how to contact them. Emails go unanswered. Messages go unanswered. So I'm going to tell you exactly how you can communicate effectively, and also how to present yourself, because how you present yourself is really important to give that GP confidence that when they're signposting a patient, that they're going to get an experience that matches up to their needs, rather than, for example, sending a patient that's maybe struggling with the menopause and with low strength to a CrossFit group. That's obviously not going to work. So it's about trying to match it up and get the right person to the right place.
Excellent. And I'm really pleased you brought up that example of Leamington Spa, because that's what really attracted me to you in wanting to do this, because of that active practice that you've been putting into place. So who are you working with in Leamington at the moment?
So we work with a whole host of people. So I'll give you some examples. When I first wanted to get activity into my patients' sort of treatment repertoire, I was kind of stuck to go, okay, look, I know I want to do this. I want to get my patients moving, but I can do a part of that, but I need support. So I went out on the practice social media and I literally just put out a message. I said, look, people of Leamington, is there anyone in the professional background, whether you be a personal trainer, a yoga teacher, a run coach, a cycling instructor, whatever, are you prepared to work with us to support our patients?
Right.
And I didn't expect anyone to reply, but I got loads of messages.
Brilliant.
What I was really surprised was that the fitness sector, they were actually super keen to work with us. I got them in. We had group meetings, and I worked with people like Mick Hurrell, who's a personal trainer for the over 50s and developed sort of strength training, Nordic walking, that kind of stuff. He's been really instrumental to helping us with a lot of groups. We've worked with, for example, Nina Mortas, who has done chair-based exercises and work in our nursing homes. We've collaborated with our local leisure centre, Everyone Active, where we now have regular free weekly swims at Newbold Leisure Centre, our local pool, where we fit in a time which is really quiet for them. So therefore they get more traffic and more people further signing up after they've completed the free 12-week trial. And we get the win of having patients to set up that behavior, because if we can support them with free sessions for 12 weeks, that can start to embed that habit, so that swimming starts to become a more regular thing. So whether it be that individual personal trainer, self-employed, or that huge, Everyone Active, massive, with so many, I'm pretty sure they're the largest maybe leisure centre across the UK, having that network now, GPs can refer to various different options. And we have a menu of over 12 different physical activity groups that we can support with, that is either free or extremely low cost, that helps to remove those barriers. And just to think of just one example, if I could, a patient of mine used to love swimming when they were in their 20s, but they had a traumatic event where they were assaulted. And since then, they were really, really nervous about entering a pool, being in sort of clothing that was exposing to them. And they never even bothered thinking about going to the pool or trying something else. But when she spoke to me, I was able to have that time to break down those barriers and say that, look, you can come in with a full suit if you like. You don't have to be in a tight swim wear. You can come in whatever you feel comfortable with. And that's enabled her to get back into the pool. And she's an incredible swimmer. When I saw her in the pool swimming, it was just so good and crazy to think that she had not been able to access the pool until that moment. And I think that's where healthcare and the leisure sector can work beautifully, because in reality, the leisure industry would have been more than happy to support her, but she just didn't expect it, or didn't feel like she could just enter a gym and ask that question, because it's very vulnerable. But they are happy to have these vulnerable conversations with a healthcare professional. And I'm able to explain that, absolutely, I know the staff at Newbold, they're incredible. They'll let you swim in whatever swimwear you feel comfortable with. And we can work together to achieve the end result, which is her swimming regularly.
Absolutely. And you mentioned some of the group activities, and I've seen some of the videos that you put out and things. Is that piece around the socialization and the mental well-being and all of that type of stuff, do you get many, can you see much benefit from that activity, using almost moving and physical activity as a reason to be together with others?
Yes. The most common thing that my patients say is that the physical activity in the groups that we run is like a side effect. Like they don't even realize they're being active, because we've always put as the number one thing is the community element, is the connecting with other people. Because in fact, you know, when they've looked at research at what we call the blue zones, these are spots around the world where we have the highest proportion of centenarians. The biggest factor that they found to improve health was community and social connection. And that's why it's so fundamental when we're doing physical activity. It's a no-brainer to try to engage and integrate community into it, because not only is it going to provide health benefits, but it's also going to make that activity easier for the patient, because they're going to find it less taxing physically when they're distracted with conversation and friendship. But it's also going to be a pull to bring them back, because the amount of times that patients say that I didn't really want to come, but I told Claire that I was coming, and I didn't want to let Claire down. You know, they form that kind of accountability with each other. So, you know, our sessions are called Run, Talk, Run, to let people know that we're not just going to go for a run. There's going to be a hell of a lot of talking as well. And our Swim Together group is supported by mental health swims, because we just know the importance that mental health can play when it comes to movement and community. So yeah, no, I think it's a must now to try to utilize all those aspects.
Good, excellent. And we've shared some of the, we're going to share some of the language and some of the tactics and the techniques and the just, I guess, persistence as well of us in our sector of moving more physical activity, getting some opportunity to talk. But are you doing anything through your Royal College of GPs lifestyle lead around how you're helping to educate GPs and your fellow colleagues?
Very much so. You know, I think that's going to be the key message here, because unfortunately, Leamington and there are a few other areas, but these are just sort of hotspots of great work. For a lot of places, we are not seeing these kind of activities happening. We're not seeing also the same appreciation of the impact that physical activity and good lifestyle can do. Now, it's very much on the rise. And over the last couple of years, even if you just look at, for example, the number of people signing up to the British British Society of Lifestyle Medicine, you can see that the interest is growing. But what we're trying to do is educate and inspire healthcare professionals to take physical activity as a serious option when it comes to the treatment and promotion of good health. We know that it outperforms any drug or any combination of drug. Like if we've heard it so many times, if it was a pill, exercise would be the most expensive medication in existence, because it's so effective. And so what we're doing at the Royal College is a number of different initiatives. One is, for example, the Park Run Practice initiative. This is a way that GP practices can engage with the local park run event. If you don't know about park run, I wonder where you've been living, but it's a weekly 5-kilometer walk or run that happens every Saturday at 9 a.m. in a local park. And this is where we want practices to go there and volunteer and to support and to signpost patients too. Now, kind of the next run above that is we encourage people to achieve what's called the Active Practice Charter. This is where you'll get an RCGP, Royal College of GPs, accredited chartership to the active practice if you achieve 5 key criteria. This is to increase physical activity in staff, to increase physical activity in patients, to reduce sedentary time in staff and in patients. And the final and most important one is to partner with a physical activity provider.
Right.
Because what I learned in my process at Leamington was I could not have achieved what I have without the fitness professionals and that sector's expertise in delivering a number of the sessions. So that's why it's really important. They have to achieve all 5 criteria to get onto the charter. And we have now 300 practices that have achieved charter status. And if you want to see where your local practice that has achieved that status is, if you just Google RCGP, active practice, and then map, you will have an interactive map with contact details for that practice, because you may want to engage with them and find out how you can support them and how they can signpost into your services, if that's something you are interested in doing. Absolutely. So because I think what we want to do with these kind of initiatives is not just encourage patients, but what you notice there is we want to encourage staff as well, because if they are active, if they gain the benefits of physical activity, they're going to be far better advocates for their patients.
No, absolutely. I totally agree. Hussain, that's been fantastic. I am so looking forward to listening to the presentations that you're going to deliver for us. So thank you so much for your time. Just to let people know, we'll put that website at the bottom of the LinkedIn post so that people can have a look direct and do something, which is great. Hussain, thank you so much. Have a really active weekend, and we will speak soon. Take care. Bye-bye.
Thank you so much. Take care.